Joining me now is Dr. Vim Patel. He is from Evolved Personal Health. Thank you so much for joining us today.
Thank you, Dr. Shuck.
We're going to talk about the evolution of medicine because every day we change something. So some days we can have eggs and so we can't have eggs. So now we're talking about blood pressure. And so we had our own level of blood pressure, which we considered hypertension. The American Heart Association, the American College of Cardiology has done a new study, and they're modifying or evolving this. So let's talk about what the new number is and how they got there.
Okay. What we had sent out about 10 years ago was something called the JNC7 that did define hypertension as 140/90. And only if your doctor had detected a number above that would they think about treating you with hypertension. What the American Heart Association did and the American College of Cardiology, they took a look over these 10 years, were we doing the right things? So they took a look at all the studies, and there were hundreds of them with hundreds of thousands of patients, and they saw that people that had blood pressures between 120 and 139 systolic also had a risk of cardiovascular disease. That's why they had this new categorization of elevated blood pressure if you're 120/80 and 130/90 or 80 to 89 made you a stage 1 hypertensive, whereas before you weren't even categorized as hypertensive. They did this in order to make sure that people can be aware of the disease risk when you have these blood pressure or the systolic numbers. It also allows the individuals to have earlier interventions.
Which we know is a better thing. The earlier we have the diagnosis, the better we can start changing these things. But how are we doing now? I mean, these numbers that we have currently are higher, and yet cardiovascular disease is still the #1 killer. So where's the fault? Where is it falling down? Where are we breaking down on this?
If we're going to blame anybody, I think the blame has to go on both sides here. Certainly, once an individual does have hypertension, it's up to the individual to make appropriate changes in order to counter the effects of hypertension. Also, physicians on their end have to promote lifestyle changes. There's certainly a gap there, and the numbers of hypertensive patients have always been increasing. But what we do know is that lifestyle change and lifestyle modification certainly does work. That gap, we understand, needs to be filled. There are certain modalities, there are certain resources that you can go to. The American Heart Association does have a pretty robust website that tells you what you need to change. Health coaching is certainly a proven modality that does take patients with medical diseases and tries to implement lifestyle changes. My practice is one of such a resource here in Tampa. We take patients to make those difficult everyday changes into their normal reality.
Right. And you know, the funniest thing, and it's not really funny, but the funniest thing is that a lot of patients that I have, they say, I don't have hypertension anymore. I have medicines and I'm normal, so I don't have hypertension. And the idea is, obviously, that's not really accurate. Once you have hypertension, you're probably going to have hypertension for the rest of your life. The medications bring you to a normal area, or the weight control does, but you still have the potential of heart disease due to the fact that your body doesn't regulate as well as it should.
Sure. I think what the medications are doing is bringing your blood pressure down. It's not treating the initial cause. And when we don't look at the initial cause of what's causing hypertension, then we're going to say things like the medication is solving my problem. What the medication is doing is reducing your blood pressure in the manner that it's designed to do. It is actually not getting rid of your hypertension, and you still will have a risk of the heart attacks or strokes if you let hypertension proceed. Really one of the only ways we can reverse hypertension is to change our habits, is to change the things that we eat, is to increase the level of activity, and to decrease our weight. So those are the only modalities that will really affect the initial cause of hypertension.
And we're talking about fixing the problem, not fixing the symptoms.
Right.
These medications, they don't work 24 hours a day. And so when you have a blood pressure medicine that holds your blood pressure down and it wears off, then you actually get it to go yo-yo up and down, and we know that's worse, right?
That's right. So there are a lot of problems with medications. Side effects of the medication certainly are a factor. Like you said, when the medication is in your system, it wears out. So we also have long-term consequences of taking medications. We do know that there are some medications that may slightly increase your risk of heart attacks or strokes, but they do bring down your blood pressure. We know some medications will interfere with the way your organs function, and we have to try to balance out these risks for what we are trying to achieve. And essentially, the medications are important to bring your blood pressure right now, but if you don't do the things that can solve the problem, that can treat the initial cause, like you said, Dr. Shuck, we're just masking the symptoms.
Yep. And we don't treat a number. That's probably the biggest problem I have, especially when I teach residents. It's the number's a number, but the person in front of you has a reason why they have that number. And if you don't know the person, there's no way that you're going to be able to fix the problem. So don't want to treat a number. We have tried treating numbers before. We're not doing a great job with this because heart disease still is the #1 killer. And we know the basis is a lot of it comes down to personal choices, when we eat, how we exercise, what we do every day. Stress is stress. We are going to have stress, but we can manage that better if we're healthier. So through your Evolve Personal Health, you help people deal with stressors. You help people deal with weight gain, proper choices in exercise. Just going to the gym doesn't make you healthy. It basically just makes you look different.
I think you got that right. There's a myriad of information out there, right? And sometimes we can get lost with everything that's out there. What we try to do is streamline a certain process for you. What to eat may be culturally based. When you eat it may be based on your occupation. So there are a lot of factors inhibiting someone from making these changes that are necessary to solve the original problem. What we try to do is understand the individual and understand the obstacles in front of them that inhibit the change. So we certainly do target hypertension in that manner, and we target all other modalities, but the one thing that you said is absolutely correct. One of the hardest things that we can do, and one of the best things that we can do, is to change our everyday, not simply taking that pill.
Yeah, the pill's not a shortcut. It doesn't take care of everything. And when we look at a lot of the problems we have, compliance is a major issue. I mean, patients know their side effects. Certain drugs make it so that we can't be happy. They make us a little sadder. So these medications come with a cost. Exercise and health comes with minimal cost. And prevention always works versus medicines work 30 to 40% of the time. So obviously seeing someone like yourself, personalizing their self, making sure that they understand where they're at and why they're there, will help them follow through. I mean, this is such a hard topic, and we've done so poorly with it for over so many years that we're just used to it now. So unfortunately, we're treating to the numbers, but docs like you treat the patient.
Well,
we appreciate that.
It doesn't have to be the status quo. There is a local resource, and there are physicians out there that will make this change and to lead you to a healthier life.
Always great to have you here. Thank you so much for joining us. Thanks for the information. And remember that the patient itself is not a number.
Absolutely. Thank you so much, Dr. Shuck.